Good morning. Today we are going to speak about pancreatitis. And since I have been treating pancreatitis successfully for last 23 years in my clinical practice, I will share my experiences. But before that, I would like to make you familiar with pancreatitis. As the name speaks for itself, pancreatitis means inflammation of the pancreas. And just a brief tour to its history from where it came. So, like COVID-19, as it came to India from the Western world, from China, same thing. The disease of pancreatitis is not mentioned in Ayurvedic text out of this Vata, Pitta and Kapha rog. It was first described by a Dutch anatomist called Mr. Nicholas Tull in 1652, where he had reported first case of acute pancreatitis. And then there was a long pause, and in 1889, a pathologist from Harvard called Mr. Reginald Fish has identified acute pancreatitis in a dead body, that he found the reason behind it. And then an American anatomist, Mr. Comfort, found chronic pancreatitis in 1946. So this is the chronological findings of pancreatitis in the world. But in India, 1937, first case of pancreatitis was identified by surgeon Dr. Kinney. But today when we talk about chronic pancreatitis, then what is the global ratio that out of 1 lakh, 13 to 52 people suffer with chronic pancreatitis? And in Indian population, surprisingly, it is very high, and especially southern state of India, where it is reported that out of 1 lakh, 114 to 200 patients suffer with chronic pancreatitis. And acute pancreatitis, which is immediate onset of the disease, is about 5 to 73 cases per 100,000. The disease is prevalent, the disease is increasing. Scientists are trying to find out what is the cause. And so far, which is established, that can be talked. So TGRO are known as causating factors for pancreatitis. T for toxins, that includes alcohol. So in the world, alcohol has been targeted as the most common causing pancreatitis. Second for autoimmune. R for recurring pancreatitis may lead to chronic pancreatitis. And the last is O. O means obstructive jaundice may cause this. And then, what are the symptoms? Most of the time, chronic or acute pancreatitis are associated with sudden onset of abdominal pain, upper abdominal pain, with radiating back, nausea, vomiting. These are the common clinical symptoms which may be present into 90% cases, but in 10% cases, there might be no symptom other than weight loss, uncontrolled blood sugar, or presence of fat in the stool. Now, we will talk about types of pancreatitis. Pancreatitis is broadly categorized into two, acute and chronic, but there are many, more than 2 dozen varieties of pancreatitis has been identified by that, but they could be covered between acute and chronic pancreatitis. When we say acute, acute means reversible inflammation. And when they say chronic, chronic means there is a permanent damage to the pancreas, especially, and it is seen by the image. And these complications are related to this chronic pancreatitis are calcification, necrosis, pseudocyst, ascites, biliary obstruction, and thrombosis. These are the common complications of pancreatitis. The diagnosis of pancreatitis is quite cumbersome. It is not easily done many times, and there are reported cases who got diagnosed and has come to death because the diagnosis was not made on time. So therefore, the diagnosis of pancreatitis, either acute and chronic, should be done by a gastroenterologist who is well versed with the diagnosis of pancreatitis as well as with other disorder of GIT. Basically, there are few blood tests associated with that, but images are the key to diagnose of the pancreatitis. They include ultrasound, endoscopic ultrasound, ERCP, MRI, CT scan, and MRCP. And right now, MRCP is the most non-invasive diagnostic tool for the diagnosis as well as to progress the monitoring of the treatment in the patient of pancreatitis. How pancreatitis treatment? So far, Western medicine said there is no cure, no radical cure for chronic pancreatitis. And whenever there is an attack, patients are admitted to the emergency because the pain may last for 2 days, and then they are treated with anti-inflammatory, painkillers, IV drip, no oral fluid, vitamins, minerals, and enzymes that is given. And in sometimes surgery is done, sometimes stenting is done, and lifelong there is a use of pancreatic enzymes. Pancreatitis is an inflammation. What is the fuss about it? But there is a peculiar nature of this disease that it is progressive in nature. Once it is there, it is there. There is a study from Australia conducted on 18,000 cases of acute pancreatitis, and the outcome was that anybody who develops acute pancreatitis, they have a risk of developing chronic pancreatitis in their lifetime. So there are a few data which I will read for you, that if a patient has acute attack of pancreatitis, he has 20% high risk of progression with at least one recurrence to CP, right? And 40% cases of chronic pancreatitis may develop cancer in their lifetime, and 90% may develop uncontrolled blood sugar. And right now, the world has reached to a time when we are going to touch 1 crore population suffering with the disease. It is now 90 lakhs people, and we don't have much data from India because there is no survey has been done. So this data what I'm presenting to you, it is from United States or other countries, or especially American Pancreatic Association, who collect data from this. But in absence of any study in India, it is very difficult to say how many patients we have. And United States has reported nearly 132,000 deaths in year 2015. The disease affects a person's physical life, mental life, social life, financial life, and emotional life very badly, because there is no cure for it, and then it is associated with frequent hospitalization, a lot of money is involved, and patient is physical and mentally debility, so there is enough burden on the sufferer of the disease. Now, after talking briefly about pancreatitis, I will come back to my data. And before I come back to my data, I will say from where I got it. I'm not a great scientist. I am an Ayurvedic doctor with a basic degree in science and BMS, Ayurvedacharya. But I born to a family of Ayurvedic physicians, where my late father, Vaidya Prakash, who practiced in Meerut in UP, used to prepare his own medicine based on Ras Shastra in Ayurveda. And while he was formulating new medicines as per the law permit to an Ayurvedic doctor to prepare own medicine and give it to the patient, he used to prepare some medicines which were based on Ras Shastra under the guidance of his Guru Maharaj Ji. And in 70s, he was making an experiment with a metal called copper, which is highly anti-inflammatory but toxic. So then he was using the inorganic poison with another poison called mercury, because mercury is the head of Ras Shastra. Rasa is a synonym of mercury. So copper and mercury, when are combined together, it is said that mercury can eliminate the toxic effect of copper. But mercury is itself a toxic. So mercury toxic effect could be eliminated by sulfur, processed sulfur. So my father was preparing a medicine by making amalgamation of copper and mercury, and then processed with sulfur in the juice of Clitoria, Ternacea, and Laphycinata, 2 herbs, which were soaked into lemon juice for 24 hours. Then he was grinding. And this process of grinding, when dried, put into fire, and then when cooled, again added sulfur, again put on fire. The process is repeated 100 times and called Gandak Jalna. It is a belief in Ayurveda that if a mercury is processed more with sulfur, it will be non-toxic, and it will become a beneficial. So while my father was making this medicine for 2.5 years continuously, incidentally this medicine was given to a patient who was suffering with advanced pancreatic disease, operated and closed at a leading hospital of the country, PGI Chandigarh. And while he was going back to his native place in Punjab, he stopped over at Golden Temple in Amritsar, and there on the recommendation of somebody, they preferred to bring him to Meerut and that critical condition. And this patient was treated by my father reluctantly, and he showed wonderful results. He showed complete recovery. And I remember when I was a student of 9th class that he gained a 38 kilo weight and lived nearly 40 years disease-free. So this practice which I inherited from my father, I continued, I learned from him. And since there was a lot of processing is involved, he was not able to repeat the same formulation again and again. There was batches which were working, there was batches which were not working. So after doing my science graduate, because I was fascinated by the observation, because he was treating some diseases which are cumbersome or incurable in modern disease, but he was showing results. I thought there is a science behind it. So I opted for it, and very soon after joining him, I could find out the reason why there was a discrepancy in the batches, and we could sort out the problem. But there was a setback. My father died in 84, and after that it took me some time to re-establish myself, making this medicine, observing the same results. And when this result came to me continuously, because the flow of patient was very poor, I started documenting my practice from 1997. And I want to make it clear, this documentation, from where it came. During my early days of practice, I got famous for treating some incurable disease in the West, other than pancreatitis. And while I was going and coming, these people were coming, I could see their documentation. And I learned that documentation, and that encouraged me to start my documentation in chronic or recurring acute pancreatitis. So here I come with the data that since January 1987 till date, we have enrolled 978 cases for different types of pancreatitis, and out of these 82% are male and 18% are female, and these have history of the disease from 1 year to 25 years. But the maximum patients have the history of less than 10 years. We have a patient from all age group. Now from less than 11 years, there are 38 cases. 11 to 18 years, 98 cases. And 18 to 45 years, there are 56 cases. And more than 45 years, 86 cases. So based on that, I can easily say the disease is Pitta dominant, because the middle age of our life is Pitta dominant. It is said the disease has a family history. But in our data of 978 cases, there are only 5% cases were those who had family history. The disease was more prevalent among non-alcoholic. 70% patients out of 978 never touched alcohol in their life. Only 30% were those who has taken occasional or regular alcohol. Similarly, tobacco users, there were 80% patients were those who never took tobacco in their life, and 20% were tobacco. But the vegetarian or non-vegetarian, if we see 50% cases, either they were taking tobacco or non-veg diet or vegetarian diet. So when we talk about acute pancreatitis and chronic pancreatitis, we can say that these patients fall from 17 subtypes of acute and chronic pancreatitis. I can name few: acute pancreatitis with pseudocyst, acute necrotizing pancreatitis, acute necrotizing pancreatitis with pseudocyst, recurrent acute pancreatitis, recurrent acute pancreatitis with pseudocyst, chronic pancreatitis with pseudocyst, early chronic pancreatitis, chronic calcific pancreatitis, chronic calcific pancreatitis with pseudocyst, acute on chronic pancreatitis, acute or chronic calcific pancreatitis, group pancreatitis, autoimmune pancreatitis, and pancreatitis cyst. Why I am repeating these things here? Because the patients who come to us for inquiry, they feel they are having a unique type of pancreatitis. But they are fall in that, and I want to make it clear that being an Ayurvedic physician, I am not a party of diagnosis. I know basic anatomy and physiology of the pancreas. I'm not a master of diagnosis. So whoever the patient come to us, they are well diagnosed. And the maximum patient who come to us, they are AIG return, all in Asian Institute of Gastroenterology, Hyderabad. And the second hospital which come to us, where the patients have been diagnosed, this is Vedanta, third is Gangaram, All India Institute. So there are cases who have been well diagnosed by the reputed hospital, by the top expert of the country. Now I will talk about what the current status. I say 978 cases came. What happened to them? So out of 978 cases, we have lost to follow 5 cases with whom we cannot make any contact. And I want to make it clear, it is not a clinical trial, it is not a research, it is simple documentation of clinical practice following good clinical practice. So we have no touch, no contact with 5 cases, they have lost to follow. There are cases, not now, but 5 years back there were cases who were coming to us, they were taking treatment, but they were not starting because we didn't have indoor facility. And taking this medicine is a trick. It is not that you take a pill and swallow and everything will be all right. Because this medicine is different, diet is different, way is different, diet and lifestyle and water, everything. So they were finding it difficult. So there is a case 24 numbers who took the medicine but never started. We have 133 cases out of 970 cases which we can say incomplete treatment. Somebody took for 5 days, somebody would take 10 days or 1 month, like that. And there are 17 deaths, 2% patient nearly, less than 2% patient have died. 6 deaths are post-treatment, 5 relapsed and died, and 1 got cardiac arrest. And the 7 out of another 7 cases, 5 relapse and dropout post-treatment, like that. And post-remission, we have completed with 463 cases with 1 year long Ayurvedic treatment, which comprised of diet, lifestyle and medicine. And out of these 463 cases, we can say they are living disease-free life, total disease-free life, fear-free life, and any treatment, no injuries, nothing. And 329 cases are on treatment till date. Now, after talking about the findings that which shows significantly high, which we have published in many journals, and last year in October there was a meet, 50th joint meet of American Pancreatic Association and Japan Pancreas Society in Hawaii, where we have submitted our abstract. And I'm very happy to say that out of 620 abstracts selected, our only 50 cases were 50 abstracts were selected for publication or presentation. So we were among those. So that's where we make our first reference of metal-based Ayurvedic treatment in the management of pancreatitis. So we presented, and our poster was liked that it is rich of content with volume that. But before that, we did some scientific study, and for that I would like to acknowledge the support from the former Chief Minister of Uttarakhand, who took interest in our work, and he initially granted some funds to understand what is this medicine. And with the help of VCP Cancer Foundation and this Indian Institute of Science, Bangalore, we carried the basic understanding what is this medicine. This medicine takes 3 years to prepare. What happens to that? These are heavy metals that can be toxic. There are so many questions. So then a project was taken where medicines were prepared following traditional methodology, using some technology, and we were observing what changes are coming. So after every cycle, this medicine was subjected to ISC for different testing, and then we found that metals are diminishing, they are converting into mineral forms, and when we have the final product, it is totally a mineral complex, and there is no free metal in any form in this formulation. So that was a big relief to us because we were unable to find out what is the medicine, how does it work. So, but now after knowing that there is no free metal in the medicine, and the great chemistry of Indian Ayurveda has the capacity to convert metals into minerals and taking metals outside minerals, so that makes sense. So this medicine has no free metal, no mercury, no copper, no sulfur. That's why when a safety studies was carried out on this medicine using OECD guideline in a renowned clinical research organization accredited by international agency and accredited by Government of India, this product showed no toxic effect up to 10 times of the doses. Liver, kidney, and other parameters remain normal in the group who received this medicine for up to 210 days. Knowing the chemistry of the medicine, knowing about the safety of the medicine, we can ascertain the reproducibility and safety. But what about efficacy? So, efficacy is one part which we are seeing in our clinical practice, but the science wants more. Every time wants more. Patients are getting better. So, are there some adverse effect or some painkiller effect? That is why a study was designed to produce pancreatitis in rats. And there is a model, L-arginine. You people might be aware of that we use L-arginine in our day-to-day life. And this L-arginine can cause pancreatitis in rats. So pancreatitis was produced, and this product which was being used for patients of pancreatitis was administered to rats, and very interesting finding came. And this was compared in comparison with methylprednisolone, that the animals who received methylprednisolone, those show anti-inflammatory properties, but all died after 40 days. So that was one thing, disease was being killed, but the patient died. But Ayurvedic medicine, on the contrary, showed that it has a strong hepatoprotective properties at the 3 mg to 4 mg per kg body weight, and if given for a long time, there was no side effect. So no side effect, only effect, pancreatitis reversal. We were excited with it, but being a scientific mind, I opted for second study, and this time what we did, we designed two groups, 3 to 4 mg per kg body weight, and same L-arginine was induced, and then the result was there to confirm what has been seen earlier. But this made us very proud and very knowledgeable, because now we know how much dose we have to give to the patient, and since we started giving it, there is less elevation of liver enzymes, though it was reversible, but we were surprised why it is happening. So this medicine only works in the human body if the body is 60, like 3 to 4 mg per kg body weight. So we decide the dose as per the body weight, and gradually when they gain weight, we increase the delivery of the medicines. Our future directions are very clear, that while we are getting patients from all over the country, especially in COVID area, we are based in the rural area of Gadarpur Tehsil of district Udham Singh Nagar, Uttarakhand. It is the border area of UP, remote area, rural area. We don't put any signboard, but we are getting patients from all over the country. Right now in our Padav hospital, we have patients from Gujarat, we have patients from Rajasthan, we have patients from Maharashtra, we have patients from Bengal, we have patients from southern state of India, Punjab. So they keep on coming. So this is the one thing that is our duty, that continue to do the practice. But same thing, a part of duty, our duty is to make it scientifically available. And how it will come? So far what we are doing, it is observation within set parameter, but preliminarily, but unless it is subjected for a clinical trial. So friends, we are able to design a randomized controlled clinical trial with our gastroenterologist friends in Bikaner, and it is almost ready. Unfortunately, there was a lockdown announced in March, and since then, all the research activity has come to the standstill. But now things are moving up, and very soon we are going to start a randomized controlled trial in association with gastroenterologists at the leading institute of Rajasthan. And meanwhile, we have set up a facility to treat 25 patients at a time. And why it is necessary to keep the patient here? These medicines are prepared in urine, metals, and mercury. Though they are non-toxic, but the dose is very tiny. And sometimes the delivery is fat. And fat is prohibited in pancreatitis patients. So when we give the medicine to the patient at home, they don't want to eat. And suppose they vomit, they're scared, they never eat. So we prefer to give supervised treatment for a few days at our campus so that we don't have any feedback, flaw show that people say we went there and we did not take any treatment. So these 21 treatments are essential to understand the medicine, for the absorption of the medicine, then whatever the diet we give. I recall when there was a girl from Pune, and she had been suffering with pancreatitis, being the lonely girl of Mummy Papa and beloved of Dada Dadi. They were very careful about it, and as we do, we start giving fat diet from the day one. So her parents were okay, but grandfather was panicked. He said, this man will definitely going to be my granddaughter. So when I brought jalebi for her, so he hidden it somewhere. And when I asked the girl, she said she didn't get, so I was a little bit angry, and next day I made sure that they get it. And so this is the confidence that we want to build up in the patients of pancreatitis, that you are not off, your life is not dead. And there is always a Bulan Darwaja. Once you do something, there is another open gate is there. And this 21 days, the patient who don't eat anything out of fear of pain and attack, they start eating, and that way. And even their parameters are high, like liver enzymes or pancreatic enzymes or pancreatic tumor enzymes, they show lowering trend. And most of the cases when they go home, they remain well, but there are a fair number of cases who do not get well, but then we have a record diary, we interview them, and then we again prescribe them that you continue with that. There are very, very few cases who come back to us again because they are not able to do it at home. So that is the current scenario. So we are treating patients, and our direction is very clear that after treating 1,000 cases, we are again going to form a booklet. Last booklet was released at 555 cases. So this will be 1,000 cases, and where you might be able to read testimonials of many cases. So these are the basic things which I talked about pancreatitis, genesis of pancreatitis, how prevalent pancreatitis is, what happens in pancreatitis, how we treat pancreatitis, how can we cure pancreatitis, and how we can arrest the disease progression which is fatal. And I'm thankful to our great masters of Ayurveda who developed such a formulations making medicine by the virtue of their intuitions, by innovation or continuous effort. So we are lucky that we have the science, and our aim is to popularize this science, especially Rashastra is very much in the air because we have seen the wonderful effect of this science on human race. So this is the corona era, and more diseases are coming up into the human body. We should be very, very careful in understanding the disease, because somehow when we are treating pancreatitis by using modern gadgets, they treat symptoms but they don't cure the cause, and that's why disease keeps on coming. So Ayurvedic treatment has been found effective in bringing complete relief, sustainable relief in number of cases, and this has to be studied further. With these words, I say goodbye to you, and we'll see you. And if you have any question, I will try to give you by the comment in the comment box. You read my this comment, this reply in the comment box of my YouTube. Thank you very much. Have a nice day.